So we're here at ISNTD Coinfections and Comorbidities here in London. I'm joined here by Jami Taylor of Janssen Pharmaceutical. Jami, you've given a very, very interesting and positive presentation this morning in terms of the holistic approach that J&J, Janssen are doing in terms of engaging with the NTD world and issues and challenges. You mentioned a specific there, Dawn, the deworming adolescents wash and nutrition program. Would you like to just elaborate a little bit on that, please?
Sure. Well, in February of last year, we had a meeting as part of our Neglected Diseases Policy Task Force with then Minister of International Development and La Francophonie, Minister Christian Paradis of Canada, where we touted the successes of our Children Without Worms program, a very extensive drug donation and mass drug administration program of mebendazole for deworming or the prevention and control of soil-transmitted helminthiasis or STH. But we were very candid about the limitations that we saw. Unfortunately, because many settings of poverty are also settings where there's poor sanitation, hygiene, and so forth, what we found is that even despite the immediate successes of our deworming programs, the impact overall was often limited, even fleeting, because the reinfection rates are so high for the reasons I mentioned. So as we discussed this with this powerful public sector figure, he said we must connect the dots. And he, from his perch in the public sector, having a line of sight into many different programs supported by the Canadian government, really spearheaded a new level of connectivity between and among different actors with ownership of historically disparate interventions, WASH, nutrition, and of course our own programs in deworming. So with the help and the facilitation of the Canadian government, we've now corralled these actors and developed new forms of collaboration and new ways of layering our interventions, our own platforms together to hopefully achieve the sustainable impact we're seeking.
I mean, it's very, very refreshing to hear a multinational player, a major actor in pharma, in the healthcare, world domain, speak like this in terms of what's really needed. We're talking about structural issues of poverty. We're talking about structural issues that don't just go away if you give a mass drug administration. And to address them is very, very positive and encouraging. So in terms of those particular types of partnerships, the day-to-day is designed for progress through partnership. You've seen quite a diverse range of people from communications backgrounds, from pharmacology backgrounds, biology, diagnostics. Is there anyone in particular you'd like to be partnering with in terms of, we don't need names, but a general area?
Based on what we saw today, I mean, it was incredible for the reasons that you mentioned. I mean, the spectrum of actors that you brought together to this particular conference and the diversity, the worlds colliding, if you will, was just fantastic to see. And there were many points of argument brought forward that certainly brought about new insights for me and my colleagues. There are also new kind of methods around education and communications that we found particularly interesting. The MTV Sugar program, for example, absolutely blew my mind in the way that it is reaching consumers, the way that it's driving impact, and the way that impact is being measured.
I mean, you've mentioned consumers then. We were also blown away by the scope and reach. We're talking about 1 billion people that can see that program, can be potentially influenced in terms of positive behavior change. So absolutely with you on that one. You've mentioned consumer insights in your presentation, and we always have felt here that part of the sustainability equation would be resolved by bringing in consumer goods companies or the consumer approach to that patient and mapping it onto a patient cohort. So what type of consumer insights would you look to leverage, ideally?
Well, we've started already in our neglected diseases space through our neglected diseases task force team and Children Without Worms program to unlock those consumer insights, even within our own company. And it came about in a really interesting way. And as you might imagine, those of us who are focused on neglected diseases may not always reach out, beyond our own kind of product subset. But through the DAWN initiative, again, deworming adolescents, WASH, and nutrition, we knew that we wanted to expand our Children Without Worms drug donation program to young adolescents, those who are ages 12 to 15 and even 12 to 18, recognizing that secondary school subset had been largely ignored by our programs, but this is a subset we didn't know as much about. We'd had a great deal of comfort in working in the primary school setting, but middle school and high school is a different ball game, especially as we're working in resource-limited settings. What surprised us was just how many insights we have about adolescents under our own roof at Johnson & Johnson. We have a product line, for example, in our consumer sector called Clean and Clear. Clean and Clear is a skincare line focused entirely on branding to adolescent consumers. And as we reached out, again, even under our own roof, as we reached out to that product team, what we found is that they had a treasure trove of insights about adolescents that never could have occurred to us. And as we dig through those insights, we're finding new ways to be able to build our program to best meet the needs of adolescents as, again, we expand our STH control and prevention work into that cohort. So a very exciting example, we think. We foresee many good things, and as we've even just begun to dig into it, we find that there are many best practices bound up in reaching out to the consumer sector.
I think that's fascinating, and I think that's probably true multi-sectorialism or multi-disciplinarism in action. So it's very good to, again, encouraging to hear that. You said holistic approach to NTDs, and I think you meant it because you ended your presentation with a little bit about Janssen Diagnostics and the development or the desire to develop point of care or diagnostics in various disease settings. Would you like to elaborate a little bit about that?
Absolutely. Well, diagnostics, as I mentioned in my presentation, are near and dear to my heart. As I work on a health systems basis, I see as a major and glaring gap in health systems a lack of diagnostics, and especially diagnostics around what you described. Inexpensive, yet high technology that can be accessible and quickly readable in a point of care setting. I believe that we're on the cusp of a true diagnostics revolution. It's been there, it's been brewing for the last 10 to 15 years, but we really have an opportunity now as a global public health community to breathe life into this diagnostics revolution and to drive incentives and development into this point of care space. I think it takes some encouragement and investment from companies like ours, and I'm proud to say that Johnson & Johnson is driving a new level of investment into diagnostics for soil-transmitted helminthiasis, again, point of care that can be used in the field with more sensitive and accurate results, and of course in other areas of priority to us. But absolutely, diagnostics we think is a missing link across so many areas, especially as we work in, again, these resource-limited settings. And the more we can harness this data revolution, the diagnostics revolution, I think the better the health outcomes will be.
It's absolutely agree with what you're saying. We, from a consensus position, we deal with lots and lots of different companies, be they in diagnostics, be that the Unilevers, the J&Js of the world, Coca-Cola, Google have come and spoken at our shows before. And the consensus position we get again and again and again, it comes down to there is an underreported, disease is being underreported because of lack of adequate diagnostics. The other structural issues that you've alluded to earlier, perhaps it's sanitation issues or clean water access to they are there and they obviously need to be addressed. But this particular area is something that a player can do. So you've mentioned STH. Are you a long way away from market to your diagnostic, or is that something you can talk about? I was going to say, how far from market are we? Is this something that you're looking to build partnerships on, or is it something that's going through the pipeline into the market, or should we not ask that?
Well, I think In some ways, unfortunately, we're still at early stage with a number of our diagnostics technologies that we think have promise for resource-limited settings. Fortunately, we're making those investments and we're making them with powerful partners. I mentioned Path, for example, an important innovator in global health technologies, really one of the best. Find, based in Geneva, whose bread and butter is diagnostics and targeting those diagnostics. In this case, our investment is for TB, but we see lots of potential application as we get to better modes of delivery and diagnostics in these settings. I think that there's a huge amount of potential as we've scanned diagnostic companies from coast to coast in the US and then globally. I think the challenge will be incentivizing those brilliant innovators on the diagnostic side to turn their attention to the developing world. And we're working, as I mentioned, at Johnson & Johnson to steer that attention through our investments.
I think it's very admirable, and I think it's very much needed in terms of having a thought leader taking such a strong position in this, in brackets, marketplace or this area. So hats off. And I'd just like to say, I wanted to ask you if anyone here would want to partner with your department or with the work that you're doing, would they be able to contact you?
Absolutely. I would welcome, as a Senior Director of Policy and Partnerships at Johnson & Johnson Global Public Health, I strongly recommend that anyone interested in our organization and the work that we do certainly contact me or any of my colleagues. And I would invite people from all disciplines in the spirit of this conference today.
Brilliant. I'd like to say thank you very, very much for making the trip over across the Atlantic. I know you're jet lagged. Thank you very much for a great presentation and for participating today. Thank you very much, Jami. Thanks a lot.
Thank you. It's been a privilege.